So this is again, it's a symposium in 2 days. This first day, this online day, is really to sort of bring everyone to the same place in the conversation. There's been a fair amount of conversation with many partners over the last few years, and particularly over the last few months, about this emerging model that's happening in Burnaby. This is an opportunity for folks from across Burnaby, and also we have a number of guests from around the province and even from other jurisdictions in the country, to just understand what we're where we are and what we're trying to accomplish. So it's really the day is broken into three pieces. The first and which we'll launch into in just a moment, is really talking about how we got to where we're going, and at the outset, where we're going, what we think this looks like. We have benefited tremendously from what has happened in other jurisdictions. We've learned from afar, and we've really been influenced and inspired from afar. And our second session will really look at where we've learned from, and we're really fortunate to have a tremendous panel with us. We'll have a couple of presentations from folks in other jurisdictions, and then we'll have a great panel discussion. I'm really excited for the folks that we have joining us. And then finally, at the in the last section, we'll dig down into not just what the elements of this plan, of this system are, but the work that needs to be done. And I'm going to be reminding you as we go through that again, as we go through that in more detail, that that there's an opportunity for you to be involved in this work. So we'll introduce day 2 of the symposium, which by that point, we hope you'll be excited to register for. So this first section, this is the nucleus. This is how did we get here? This is what our journey has been. But really what we're trying to do here is build a formal model that builds on the great collaborative culture within our community and the primary care network. I do want to say, though, I think it's really, so this is an integrated model for health and well-being in Burnaby. The PCN has taken a significant role in moving us toward this place of building an integrated model. But what's really clear is that this is not a PCN initiative. This is something that has come out of the primary care network in Burnaby because of the conversations, because of the mandate it's had, and because of the way that that work has taken place. But there's a clear understanding that in order for this to be successful, it can't and won't be held by the primary care network. It needs to be more broadly held. It needs to be community held. One of the things that we'll be working on as we move through building this model out is understanding what the best governance is, what table it may sit at. And certainly there may be a role that the primary care network or the partners in the primary care network take in moving that forward, or perhaps even acting as stewards. But and I'm going to reiterate this, the important thing will be that it's community held. And what that means is that everyone in the community sees this as something that they are part of, and that will be really important for its success. I know that many of you have been forwarded the brief, and I know that many of you probably said, "Wow, that's a lot of pages." But it is still available to you, and there's a link available today, and we'll do our best to give you a fulsome picture of its evolution as we go through our conversation today. So there is a piece here, and I do want to talk about the role that the primary care networks has played in this. And I do also want to acknowledge Sherman Chan, who is one of the co-chairs of the primary care network, and Sherman is with Mosaic and also is the co-chair of the Burnaby Interagency Council here in Burnaby. Georgia Becue, who is the executive director of the Division of Family Practice, is also one of the 3 co-chairs and is with us today. And Justin Lo Chang, who is the director of primary care with Fraser Health, is the other third co-chair of our PCN steering committee and is also with us today. So the vision for Burnaby, really, it's the success of our PCN lies in the health of our tripartite relationship and how effectively we're able to share, care, cross-refer, and respond to the needs of our community. to incorporate community and health authority services, and to streamline our processes to optimize health and wellness outcomes in Burnaby, excuse me. When we set out to design this PCN, we quickly understood the need and opportunity to go beyond primary care in the doctor's office and look at the full scope of health and well-being, with an understanding of what a huge role social determinants play in our patients' health and wellness. We knew that in order to truly address this broad scope, we would need to work effectively with a very broad range of partners. So we've ended up with a truly tripartite primary care network. It's the folks from Fraser, folks from the division, and folks from the community. And that community representation, I think, is really, it's a key piece here, because we're really fortunate in Burnaby that we have a very cohesive a group of community agencies that has been supported by the city, the Burnaby Interagency Council, and supports one another. They work very well together and have done so for a very long period of time. So in Burnaby, when we thought from the PCN point of view, how do we connect with community? We were really lucky that there was a collective group working really well together that we could speak to. And this is, all of our initiatives and activities have been taken with this tripartite lens. It's really unique in primary care networks. I think that Burnaby was one of the first primary care networks, and therefore had a little bit more opportunity to self-define, and really it clearly said that this is the way we would like to take this. And I think there's not another community in BC that's come to quite the same realization as Burnaby has, although I know that many are on a similar path. But it really is a tribute to the existing culture of collaboration across the social agencies. So we took a purpose-designed process to bring people to the table at the outset. From the social agencies, from the city, from the many departments of Fraser Health, from the school districts, really from anyone who had an interest, and that was a pretty broad range. The first proposal we put forward to the ministry really laid out how this could work. It looked at how we could support this much broader health and well-being range and address social determinants. And the ministry was very strongly supportive of it, but this was in early days of the primary care network. And so they were at the point of understanding what resources they would have available to put forward. And certainly, by the way, as they looked at their mandate and they looked at those resources, the resources that they had were well directed within health, but were narrower than what Burnaby was necessarily looking for. So they weren't able to fund the whole piece of that. And that was interesting, because we went back to the community partners who'd been so involved in building this plan and said, well, we tried to do this, but that source isn't the perfect source of funding. We don't know how to go forward. And what was really amazing was virtually every one of those partners, in fact, I would say every one of those partners said, it's unfortunate we didn't get the funding we may have asked for, but we want to stay as part of this. We believe, we see ourselves as part of this picture that we're starting to draw, and we want to continue to be so. It really was a tribute not only to the kind of investment that folks had already made in this collective vision, but to the level of trust that had really begun to take hold through the development process. So I know you're starting, for folks who haven't been involved in this conversation, there's a couple of questions. What exactly are we talking about? And certainly we're going to talk more about that as we go through. But why do we think it's possible? Why do we think it's possible for us to move in such a significant way with a community the size of Burnaby, with 250,000 people? How are we able to bring all those pieces together? Well, I think there's a couple things. One is that I think that foundation that I talked about of collaboration in Burnaby that's already has been in place for a long period of time is so critically important. But I also, the work that we've been doing within the primary care network as the primary care network came along was significant in terms of we were doing projects that were clearly working, always aimed at integrating, always aimed at working together. And so the work that we're trying to take on is to formalize some of that rather than start from the beginning. We're going to need some resources to bring it to fruition, but we really look at multiple avenues to be able to get that support. There's a lot of interest in the approach we've taken. and people are seeing it as the way of the future, and we really think that we're there now. Huey, I'm just going to ask, excuse me, is Kimberly on the call? I don't see you, Huey.
Sorry, I'm sharing my screen. So I'm here and I don't see a Kimberly yet.
Okay, so that's hopefully Kimberly will join us in a moment, but we'll just move along just a little bit. So really, in the last 4 years, the amount of work that's happened through the PCN has touched on all parts of health and social supports in the city. When our agencies connect and work together, not just one another, but with the doctors in the community and Fraser Health clinicians and service providers, we develop an innovative, effective solutions that are easily understood, universally supported, and rapidly enacted. This is a key partner in this obviously has been the family doctors, and it's already impacted them, and I think that the doctors have seen the opportunity as going forward. We have Dr. Jennifer Moore with us today, and Jennifer is a family doctor who is also one of the earliest members of the Division of Family Practice, and it has been a leader in this change we're going through. And Jennifer, maybe you can share some of your thoughts on this.
Well, I think I would begin to say that I feel I've been very fortunate to be a part of this journey, because I was originally on the board almost a decade ago when we first started to look at the model of what they call the patient medical home and the patient care network. Patient medical home roughly is essentially what goes on in our offices when we see patients, et cetera, and what is wrapped around that. But the patient care network, as we have been talking about, is the larger community, and sometimes that will, yes, involve other medical interests, as well as, of course, the larger community. And I think it wasn't until we started to map this out, and when you start getting creative and start thinking about everything you wish for your patients, it became abundantly clear that we were part of a community, and that there were many community agencies out there that would be helpful in ultimately achieving our healthy goals for our patients. And one of the things I think that was also rather unique about it was was asking physicians themselves where we saw the gaps. And I always hate that term, gaps in medical care, because it somehow implies that these things don't happen, or these days, sometimes people continue to talk about the issue about, private healthcare funding. But really, I saw those gaps more as a way of figuring out how do we bridge to what is available in our community. And I think that's been an amazing journey, really, over the last decade, and in large part to, I think, our tripartite structure. If you were to ask me questions about, how has this improved or supported my patients, I think it's been sometimes very remarkable, sometimes quite subtle. I also sat on a committee that came very quickly together and was very interesting during COVID, and that had to deal with the rollout of the COVID vaccine. And when you tried to sit there and think about how do we as a community, what are the issues that are unique or the same to Burnaby, I think it was quite amazing how fast all that managed to roll out, in terms of up and getting a testing site, and then also rolling out and trying to adapt to our community the specific needs around COVID vaccinations. So that's only one example. And I think constantly, as we have these meetings, new other issues come up, because physicians like to be heard. And I think we often can, give better ideas about what we need to do going forward.
Thanks, Jennifer.
Yeah.
And I think that, you know, it's interesting. One of the things that's you know, I've had a chance as we've gone through this process to work at a community level with providers and with all the different partners, really at a quite an operational level some of the time, and there are light bulbs go off, you know, as we talk about particular situations, given situations, as we talk about you know, given issues, when folks from the health authority, when doctors, when with social agencies, the people from the social agencies who are working with the same people come to understand the different perspectives and the different services that are offered, that it shifts everybody's thinking a little bit around not just that person, but around the community as a whole. And I think that from the health authority perspective, this primary care network has certainly seen a tremendous amount of collaboration in terms of what kind of resources have been brought into the PCN and how they've been brought out into the community, and how we've been able to capitalize on those relationships in the community around the PCN resources, but even more so around the way that the health authority is working in other areas. So I think in particular around home health and the way those folks have begun to connect with the social agencies and share information and share supports and shape their supports and services with better understanding. We have Theresa Guscott with us today, who's the Director of Clinical Operations in Burnaby, who's been a key partner. I'm hoping, Theresa, you might speak to us a little bit about just what that's meant from a health authority point of view.
Certainly. Thank you, Jeff. And it's an honor to be able to work with all of you. I joined the team in 2019, and it's been amazing to see the collaboration and the streamline of services. Just working with our community partners, with our doctors, with the PCN. It's been a really amazing collaboration that's really smoothed those partnerships. And as you said, Jeff, the community agencies are reaching into home health, and home health is reaching to the community agencies. So it's been really amazing. I think we all benefit from that, and most importantly, our patients and our residents of Burnaby benefit from our collaboration. It's very client-centered. That's something that I've really seen over the last 5 years, 4 to 5 years, and really gaining better understanding what's available to our patients, to our clients in this very complicated system. And it's a big undertaking to work all together, but I think we've all done that really well. And just that collaboration that really increases, from my point of view, the timeliness access to Fraser Health Services and also to partnership services. I do know our community health nurses are reaching out and to Neighbourhood House, for example, and Neighbourhood House is reaching in and really following up closely to wrap our services around our clients. Really looking forward to ongoing collaboration with the GPs and our CHNs visiting all of the offices, and our team, attends the community fairs as well as attending the local leadership team with all our partners. So we're really thrilled about the progress to date and really look forward to moving on as well.
Thanks,
Thanks,
Theresa.
Jeff. I think Parm might be on, and she was just going to add a little bit to the health services side, if that would be okay.
That would be great. We're in this, and I'll let folks know that every time we do a webinar, it's always tricky because we have two different types of invitation. We have the invitation to the webinar, and we have the invitation to the panelists. And now I see Parm come on. Her timing is perfect. Parm, Theresa just kind of passed it to you. Are you ready to take that baton?
Pass the baton.
Yes. Good morning, everyone. Good morning.
Thanks,
I was here, but I think I was having some technical difficulties. So thank you. Thanks, Jeff, for letting me join this meeting. I just wanted to share a little bit of a background. I was actually one of the first primary community care nurses that started working with the family physicians 4 or 5 years ago. And so I guess I can speak on behalf of what's kind of transpired. In Burnaby, I noticed when I was doing that role, we had a little bit of partnership with the community, but I think over the last 4 years, the partnership has been a lot stronger with working with the family physicians and our community partners. I've noticed a huge, there's a benefit for our clients when we do have those partnerships. Just wanted to let everybody know that, we are, as we transition, we are to the full scope CHN model. We're continuing to upskill, train our CHNs to full scope, dealing with complex palliatives, complex wounds. So it's ongoing training that's been happening for a number of years. And I think by end of this year, we will have completed that. And also the referral process, we had 2 separate teams, but the referral process will be a little bit more streamlined for the family physicians as well, where they will just, it's a single point of contact to coordinate better care for our clients in the community. So we built relationships and partners with our social prescribers, Better at Home. So there's services out there that our CHNs are finding that it's really helpful for our clients as well. So just wanted to share that. Thank you.
Thanks, Parm. Thanks, Theresa. Much appreciated. And so, that's I think I mentioned earlier the level of collaboration that happens within the social agencies in Burnaby has been such a foundational piece. But the advent of bringing sort of healthcare to the table in this partnership, I think, has been of real benefit to the social agencies. And I think that, it's really, Kimberly Barwich from Burnaby Neighbourhood House is with us. And just before I ask Kimberly to speak, I'm just going to share, I remember a conversation I had with Kimberly before I knew Kimberly 4 years ago. And we talked about, this is kind of the picture that of the integration of health and well-being and that we're thinking about. And this is a kind of addressing, and I remember Kimberly's caution and because I think that there's a sort of a hearing this before, and that we got a lot from the social agencies, that they, what sometimes they would feel like stuff was false promises, but I think that they've I'm going to ask Kimberly to tell us what she thinks, but I think she started to see how that's played out, and I think that there's some real enthusiasm as to what this new model might mean for the community and for the social agencies as well. Kimberly, I'll turn it to you. Oh, are you there? You say you're there. There you are.
Here I am. Yes, I was here the whole time. I was just in the wrong section. So yeah, thank you, Jeff. And you're right. There was a certain amount of wariness on my part when I first began to meet with Jeff and with the team. I've worked in Burnaby for a long time, for over 20 years as part of the Neighbourhood House. And I think Burnaby is unique to a lot of communities in the sense that we have an incredible collaborative spirit. And so amongst agencies, there has always been this collaborative push to serve the community in the best way that we can. But with the exception of public health, we were often alone at the table. And so that that has always caused a certain amount of difficulty in creating pathways for participants in our programs to access the kind of programs and services that they need. As we all know, people are not without a wide range of needs. And so a social services agency can only serve somebody to the extent that their mandate goes. And health needs to be part of that picture. And we've always believed that, but it's always been very difficult for us to access health in any significant way. And I think that I began to see the differences during the pandemic. And one would see very few bright lights coming out of the pandemic, except for, I think, how the PCN stepped up to the plate during the pandemic and really showed how they were coming to the table in a really significant way. And so that's where I think things began to shift in Burnaby. And there was a light bulb, I think, amongst all of us in the social services agency that things could be different. And so they have been very different. And during the pandemic, we had a number of working groups, and we were so thankful to the PCN during that time to take on the leadership of those working groups. We were looking at issues of seniors. We were looking at issues of low-income folks in the community. We were looking at how to connect people to digital literacy during the pandemic, and we needed a structure to work together. And Jeff and the PCN, Jeff taking the lead at those tables, really pulled us together. And so what I've noticed over the years now that we've been working in this new model is that now when I'm working with somebody and when my team is working with someone, we have so much, our connections to all of the health services have become so much stronger. Connections to allied health, connections to home health. I think that was already mentioned by Parm and Theresa. Connections to the division, individual clinics and doctors. There have been huge connections forged, which has, I think, improved the outcomes for the folks that we're all working with. And I think that I will end by saying, there's a need that we've been talking about for systemic changes that take us beyond individual connections. If I know somebody personally in home health, that has often been our way in to support an individual person. But I think that this model takes us beyond that and takes us to systemic connections that are built in and allow us to do this work more seamlessly across the spectrum of support that we all give. Thank you.
Thanks, Kimberly. That's great. And I think that's, it really does go to, this is where one of the things that Kimberly points to, and that all of our speakers have pointed to, is what we've done well is build relationship. And it's key, but where we're at is we've come to understand that we need to be and have the potential to build a formal model for this integration work that is sustainable and that goes beyond those relationships. The relationships are still critical, but the system needs to it needs to stay as effective no matter who comes or goes within it. It can't be dependent on any particular person. And it needs to be a community-defined, designed, and owned system for health and well-being, one that serves everyone in the community, allows our providers, whether they're in health or in the community, to work at the top of their abilities. Too often what we see is our clinical providers, also our social service agency providers, are doing far more than what the top of their scope is. They're undertaking work that really takes them away from the best work that they can do. So it's complex what we're trying to build here, and this diagram kind of shows it. But at the end of the day, we're talking about a systemic approach to our community taking collective responsibility for its health and well-being. So that really what that comes down to is that we move from, this is not your job, it's not my job, it's not their job, It's our job. I kind of talk about the types of responsibility. There's distributed responsibility, which is sort of the hierarchical and siloed system that we have. There's shared responsibility, and which we, sometimes we see initiatives around how do we share care, how do we share responsibility, and that's the next one. And what we're trying to get to is collective responsibility. So we all understand that the health and well-being is all of our responsibility. So the slide shows various elements, and we'll bring this slide up again, that are described in the document, and it talks about how they'll be implemented. It's important to know that we're looking at ways to build a comprehensive big data picture for Burnaby. I think that I'll talk a little bit more about that, but it's such a key element, and a communication backbone that will allow timely connection between providers and maintain up-to-date information on all the programs, services, and supports. Each of them serves a particular purpose, but probably the most important thing about the elements as you look at these is they all serve one another, and there's an awful lot of overlap between them. The system feeds itself. When a provider across health and social services, providers across health and social service have an understanding of, and more than that, a relationship with each other and what they provide, they create a strong, responsive web to hold and build our health and wellness. When the whole community is involved and connected, that web is infinitely strengthened, not just through action, but through a real sense of collective ownership. And you can see that that's a theme. So what does this mean? I mean, when realized, this system will ensure that everyone, seniors, homeless, newcomers, immigrants, youth at risk, you, me, will be able to get the right supports for what they need to make or keep themselves well, where and when they need it. It's the kind of model that family doctors and other providers want to work within. It's the kind of model that people want to live in. It's the kind of community that people want to live in. Later on, we'll hear from some folks in rural communities, and it's interesting. I had the time to meet with a group of rural doctors a few weeks ago, and one of them's theory was, what you're talking about is the kind of system that is inherently in place in some rural communities, but there's a point. There's a population point, and I think that doctor said it was about 3,000 people. Once you get beyond 3,000 people, it's no longer natural that it happens. It starts to break down, but it is there. There's a way to do this, and people want to be there, and people who live in and work in those communities stay in those communities. And our task is to build a system that will work in a population of 250,000 people. Burnaby's perfectly positioned to do this, because of the ongoing effort that we're talking about, and the support of the city and its department, but also because of its size and its diversity. 250,000 people. It's not too big. It's not too small. It's as diverse as any community in BC in terms of economy, language, and ethnicity. There are over 60 languages spoken in Burnaby, and I actually have heard the number 90 thrown around. It's a very diverse community. As we plan and build our model, we're going to look at strategies and processes that can easily be scaled and replicated. At the end of the day, if it works in Burnaby, it will work in any community in BC. We believe that if we do this properly.